mistakes can always happen. So I've put some examples here so that you can see how things work in Croatian. As for the level of spelling or orthography, we mostly encounter errors in lowercase versus uppercase, in phonetic changes and units of measurement. So for example, as you can see here in Croatian, we must separate the symbol for percentage from the number. Or for example, here, we use comma instead of full stop as a decimal separator, and we use dash instead of a hyphen for writing ranges, also with blank spaces from both sides. When it comes to the level of formation, especially adjectives, we usually encounter errors regarding derived words, prefixes, and suffixes. So it's really important to refer to relevant sources that I've mentioned before, and we need to actually see which term is correct. So for example, we're not going to say enzimatski in Croatian, we're going to say enzimski. And it's also important to be consistent in terminology throughout the translation. So we're not going to use one term in the beginning of the text and then use some other terms later. It's very important to stay consistent because that improves translation quality in the end. As for syntax, here we really have a wide range of possible errors and mistakes, mostly with inflection and word order. And as I've already mentioned, since Croatian has strict grammar rules that govern the formation of sentences, this is something that English-speaking clients have difficulty understanding. So we sometimes receive questions, for example, why have you used virus hepatitisa C in one sentence and virusom hepatitisa C in another sentence? So we then have to explain that the first case is nominative and that words are formed according to inflection, which is why terms will change throughout the translation in Croatian regarding the form, because in English, hepatitis C virus is always hepatitis C virus. So English has no cases, so therefore no change of form in this sense happens. Okay. When it comes to the word level, here we mostly need to be careful how we deal with loan words and synonymous words. So for example, as you can see here, kretanje crijeva is not the correct term because it's a too literal translation of the term bowel movement. So the correct term would be pražnjenje crijeva. Also, bol u grudima would be a literal translation of breast pain. So, but actually we need to translate chest pain or thoracic pain as bol u prsnom košu because the meaning is different. And one of the most important things recently that I've read from the recommendations from the Central Ethics Committee is that alternative treatment in Croatian should be translated as drugi oblik liječenja or druga mogućnost liječenja. I've encountered this in many texts. The reason is because alternative treatment, the word alternative can have a very different connotation in Croatian and may refer to alternative medicine, which is of course not what we're aiming at when we're dealing with medicine and pharmacology. So we also need to be careful how we translate these terms. As for the semantic level, here we basically deal with wrong meanings. So for example, I very often encounter that adverse event and adverse effect are translated the same. But first and foremost, these two terms do not even have the same meaning, although very similar. But adverse event is something that can happen to a patient that is not necessarily related to the medicinal product that has been administered. Whereas adverse effect is a direct consequence of the administration of a particular medicinal product. So we also need to be careful to translate the first term as štetni događaj and the latter as štetni učinak. But as you can see here, adverse effect is the same as side effect, which is also the same as adverse drug reaction, which is translated as nuspojava. I've also often encountered that COVID-19 is translated as virus COVID-19, but of course we know that the virus is actually SARS-CoV-2, which causes COVID-19, which is a disease. So we need to be able to differentiate between these terms as well. I've also put some examples here, so you can see that one letter makes a big difference in meaning. So we must be very careful when dealing with words that have a similar form, but completely different meanings, because of course, mistranslations in the life sciences industry can lead to very serious consequences. So, for example, palpation means feeling with the fingers or hands during, for example, a physical examination, while palpitation signifies abnormal heart rhythm. Where, for example, ileum is the last part of the small intestine, while ilium is the widest of the three bones that actually form the pelvis. So we're talking about completely different body parts here.